This doctor thought he could get away with treating a black patient like trash. But what he didn't know was that this wasn't just any ordinary patient. This was someone who had the power to destroy his entire career in just 24 hours. And by the end of this video, you'll see exactly how one moment of racism led to the complete downfall of a doctor who thought he was untouchable. Dr. Richard Hayes had been working at Pine Valley Medical Center for 15 years. He was known as one of the best heart doctors in the city. Wealthy patients came from all over the state to see him. He had a big house and expensive cars, and everyone respected him, or so he thought. On this Tuesday morning, Dr. Hayes was running late. He had played golf the night before and stayed up too late drinking with his rich friends. When he walked into the hospital, he was already in a bad mood. He hated Tuesdays because that's when the hospital took patients with basic insurance. He much preferred his private patients who paid big money. Marcus Johnson sat quietly in the waiting room. He was a 45-year-old man wearing a simple blue shirt and jeans. He had been having chest pains for weeks, but his regular doctor was out of town. The emergency room had referred him to Dr. Hayes because his symptoms looked serious. Marcus had good insurance through his job at the post office, but he didn't look wealthy. He didn't wear fancy clothes or drive an expensive car. When the nurse called Marcus's name, he followed her down the hallway. She was a kind woman named Sarah who had worked at the hospital for 8 years. She had seen Dr. Hayes treat different patients in different ways, and it always made her uncomfortable. But she needed her job, so she usually stayed quiet. Dr. Hayes barely looked up when Marcus walked into the room. He was scrolling through his phone, checking his golf scores from the weekend. "Sit down," he said without looking at Marcus. His voice was cold and unfriendly. Marcus sat on the examination table and waited. Dr. Hayes finally put down his phone and glanced at Marcus with obvious dislike. "What's the problem?" he asked, like he was annoyed to even be there. "I've been having chest pains for about 3 weeks," Marcus explained politely. "They're getting worse, especially when I walk or climb stairs. My regular doctor is out of town, so the emergency room sent me to you." Dr. Hayes sighed loudly, like Marcus was wasting his time. "Chest pains, huh? Let me guess. You smoke, you drink, you don't exercise, and now you want me to fix 20 years of bad choices in one visit." Marcus was shocked by the doctor's rude tone. "Actually, I don't smoke or drink. I run 3 times a week and eat healthy food. These pains are different from anything I've felt before." Dr. Hayes rolled his eyes. "Sure they are. Everyone thinks their pain is special." He didn't bother to examine Marcus properly. Instead, he spent less than 2 minutes listening to his heart with a stethoscope. He didn't check Marcus's blood pressure, didn't look at his previous medical records, and didn't ask about his family history. "It's probably just stress," Dr. Hayes said, already writing on his prescription pad. "Take some pain pills and get more sleep. These people always think everything is a heart attack." Sarah, the nurse, heard what Dr. Hayes said. She couldn't believe a doctor would dismiss a patient so quickly, especially someone with chest pain symptoms. But she was scared to speak up because Dr. Hayes had a bad temper and could get people fired. Marcus tried again. "Doctor, I really think something is wrong. The pain is sharp and it goes down my left arm. My father died of a heart attack when he was 50. Dr. Hayes stopped writing and looked at Marcus with anger in his eyes. "Are you trying to tell me how to do my job? I've been a doctor longer than you've probably had that job at, let me guess, some factory or warehouse?" "I work for the Postal Service," Marcus said quietly, trying to stay calm. "Same thing," Dr. Hayes said with a mean laugh. "Look, I don't have time for people who think they know medicine better than me. Take the pills I'm giving you and stop wasting my time. There are real patients who need to see me today." Sarah felt sick to her stomach. She had never seen a doctor treat a patient so badly. She wanted to say something, but she was afraid of losing her job. Her daughter was starting college next year, and she needed the money. Dr. Hayes handed Marcus the prescription without looking at him. "The desk will schedule your follow-up appointment. Try not to come back unless you're actually dying." Marcus took the prescription with shaking hands. He couldn't believe what had just happened. He had never been treated so badly by a doctor in his life. As he walked toward the door, he turned back to look at Dr. Hayes. "Doctor, can I ask you something?" Dr. Hayes looked annoyed. "What now? Would you have treated me the same way if I were white?" The room went completely quiet. Sarah stopped what she was doing and stared at Dr. Hayes. She knew Marcus was right to ask that question, because she had seen Dr. Hayes spend an hour with wealthy white patients who came in for simple checkups. Dr. Hayes's face turned red with anger. "How dare you play the race card in my office? I treat all my patients the same way. Maybe if people like you took better care of yourselves, you wouldn't need to come to the hospital so often." Marcus didn't argue back. He just nodded sadly and left the room. But as he walked down the hallway, he took out his phone and did something that would change everything. He opened his contact list and found a number he hadn't called in years. "Hello, this is Marcus Johnson. I need to speak with Dr. Patricia Williams at the State Medical Board. Tell her it's urgent, and it's about a doctor who needs to be investigated immediately." Dr. Hayes had no idea that Marcus Johnson wasn't just any postal worker. He was actually the brother of Dr. Patricia Williams, one of the most powerful people in the state's medical system. Patricia had spent 10 years investigating doctors who mistreated patients, and she had been waiting for the right case to make an example that would change everything. When Marcus called his sister, she listened carefully to everything that had happened. She had heard stories like this before, but this time it was personal. This time, someone had disrespected her own brother, and she was going to make sure Dr. Hayes never treated another patient the same way again. "Don't worry, Marcus," she told him over the phone. "I'm going to take care of this. But first I want you to go to City General Hospital right now and get your chest checked properly. What that doctor did wasn't just wrong, it was dangerous." Marcus went to City General, where a real doctor examined him carefully. The test showed that Marcus was having early signs of a heart attack. If Dr. Hayes had done his job correctly, he would have caught it immediately. Instead, his racism had almost cost Marcus his life. Dr. Patricia Williams hung up the phone and immediately started making calls. She called the hospital director, the head of the medical board, and several journalists who specialized in medical stories. By tomorrow morning, Dr. Hayes would wake up to find his entire world falling apart. But the most shocking part was still to come. Because Dr. Patricia Williams had been planning something for months, a secret investigation into Pine Valley Medical Center. She had received dozens of complaints about doctors treating minority patients badly, but she needed proof. Now, thanks to her brother's experience, she finally had everything she needed to shut down the discrimination that had been happening for years. Dr. Hayes finished his day thinking he had handled another annoying patient. He went home to his big house, ate dinner with his family, and went to bed early. He had no idea that his phone would start ringing at 6 in the morning with the worst news of his professional life. The next morning would bring reporters, investigators, and a lawsuit that would not only end his career, but also change the way hospitals across the country treated their patients. All because he thought he could get away with being racist to the wrong person's brother. Dr. Hayes woke up at 5:45 a.m. to the sound of his phone ringing. It was his boss, Dr. Robert Chen, the director of Pine Valley Medical Center. Dr. Chen sounded worried and angry. "Richard, we need to talk immediately. Come to my office before you see any patients today. And Richard, bring a lawyer." Dr. Hayes sat up in bed, confused and scared. "What's going on, Robert? Why do I need a lawyer?" "The State Medical Board is here. They have a warrant to review all your patient files from the past 5 years. There are also 3 reporters in the parking lot asking questions about discrimination. Get here now." Dr. Hayes hung up the phone and felt sick to his stomach. He had no idea what was happening, but he knew it was bad, very bad. When Dr. Hayes arrived at the hospital, he saw news vans in the parking lot. Reporters were setting up cameras and interviewing people. He tried to sneak in through the back door, but a reporter spotted him. "Dr. Hayes! Dr. Hayes, can you comment on the allegations of racial discrimination? Is it true that you refused to properly treat a black patient yesterday?" Dr. Hayes ran into the building without answering. His heart was beating fast, and he was sweating even though it was a cold morning. He went straight to Dr. Chen's office and found it full of people he didn't recognize. Dr. Patricia Williams was sitting at the conference table with her team of investigators. She was a tall, serious woman with gray hair and sharp eyes. She wore a dark blue suit and had a thick folder of papers in front of her. When Dr. Hayes walked in, she looked at him like he was something disgusting she had found on the bottom of her shoe. "Dr. Hayes," Dr. Chen said nervously, "this is Dr. Patricia Williams from the State Medical Board. She's here to discuss a complaint filed against you yesterday. Dr. Patricia Williams stood up and looked directly at Dr. Hayes. Dr. Hayes, I'm here to investigate your treatment of Mr. Marcus Johnson yesterday afternoon. We have reason to believe you provided substandard care based on racial bias. Dr. Hayes felt the blood drain from his face. I don't know what you're talking about. I treat all my patients the same way. Who is Marcus Johnson? He's the black man you spent less than 3 minutes examining yesterday. The man you refused to run proper tests on. The man you told to stop wasting your time. Dr. Williams's voice was cold and professional, but Dr. Hayes could hear the anger underneath. I don't remember exactly what I said, but I always provide appropriate care. Dr. Williams opened her folder and pulled out several sheets of paper. Let me refresh your memory. You told Mr. Johnson, and I quote, "These people always think everything is a heart attack." You also said, "Maybe if people like you took better care of yourselves, you wouldn't need to come to the hospital so often." Dr. Hayes's mouth fell open. How did she know exactly what he had said? Had someone been recording him? Furthermore, Dr. Williams continued, you spent less than 3 minutes examining a patient with classic heart attack symptoms. You didn't check his blood pressure, you didn't review his medical history, and you didn't order any tests. Meanwhile, your appointment records show that you spent 45 minutes with your previous patient, a wealthy white woman who came in for a routine checkup. Nurse Sarah had been called into the meeting as a witness. She sat quietly in the corner, looking nervous but determined. Dr. Hayes realized that she had told the investigators everything she had seen. Sarah, Dr. Hayes said desperately, tell them how I treat all my patients with respect. Sarah looked at him sadly. I'm sorry, Dr. Hayes, but I can't lie anymore. I've seen you treat patients differently based on their race for years. Yesterday was just the worst example I've ever witnessed. Dr. Williams pulled out more papers. We've been investigating complaints about you for 6 months, Dr. Hayes. We have statements from 12 different patients, all minorities, who say you provided them with inadequate care. We also have testimony from 4 nurses and 2 other doctors who witnessed discriminatory behavior. Dr. Hayes felt like the room was spinning. 6 months? You've been investigating me for 6 months? This is impossible. I'm a good doctor. I save lives. You save some lives, Dr. Williams corrected him, but only if those patients have the right skin color and enough money. Mr. Johnson went to City General Hospital after your appointment. Do you know what they found? Dr. Hayes shook his head, afraid to hear the answer. He was having early signs of a heart attack, the kind that kills people if it's not caught early, the kind that any competent doctor would have diagnosed immediately if they had bothered to do their job properly. The room was completely silent. Dr. Hayes realized that his racism had almost killed someone, and now everyone in the room knew it. Dr. Chen spoke up, his voice shaky. Richard, the board of directors held an emergency meeting this morning. We're suspending you immediately pending the results of this investigation. You're not allowed to see patients or enter the hospital except for official meetings. Dr. Hayes couldn't believe what was happening. Robert, you can't do this to me. I've worked here for 15 years. I've made this hospital millions of dollars. You know I'm a good doctor. A good doctor doesn't almost kill a patient because of their skin color, Dr. Chen replied firmly. Dr. Williams stood up and gathered her papers. Dr. Hayes, you're required to appear before the State Medical Board next Tuesday at 9 a.m. We'll be reviewing your license and determining whether you're fit to practice medicine. I suggest you use the time between now and then to think very carefully about your behavior and whether you want to continue practicing medicine at all. After everyone left, Dr. Hayes sat alone in the conference room. His hands were shaking and he felt like he might throw up. How had his life changed so completely in less than 24 hours? His phone started buzzing with text messages and calls. Other doctors at the hospital had heard what happened. Some were supportive, but many were angry that his behavior had brought negative attention to the entire hospital. Dr. Hayes went home and found his wife waiting for him in the kitchen. She had seen the news reports on television. Richard, they're saying you refused to treat a black patient properly. Please tell me it's not true. Dr. Hayes looked at his wife of 20 years. She was a teacher at the local elementary school, where half the students were minorities. She had always taught him to treat everyone with respect and kindness. It's complicated. Linda. The media is making it sound worse than it really was. Linda stared at her husband like she was seeing him for the first time. So it is true. You discriminated against a patient because he was black. Dr. Hayes tried to explain, but the words sounded hollow even to him. He wasn't really sick. These people come in all the time complaining about nothing. I was just being efficient. Linda's face went pale. These people? Richard, listen to yourself. You sound like your father. Dr. Hayes's father had been openly racist his whole life. Dr. Hayes always thought he was different, better than his father. But now he realized he had just learned to hide his racism better. That evening, Dr. Hayes got a phone call from his lawyer. The news was even worse than he had imagined. Richard, this isn't just a medical board investigation anymore. The patient's family has filed a lawsuit against you in the hospital for medical malpractice and civil rights violations. The FBI's Civil Rights Division is also opening an investigation. This could result in federal criminal charges. Dr. Hayes hung up the phone and sat in his empty house. His wife had taken their children to her mother's house because reporters were calling and driving by their home. His career was over, his marriage was in trouble, and he was facing the possibility of going to prison. All because he couldn't see past the color of Marcus Johnson's skin to the human being who needed help. But the worst part was still coming. Because Dr. Patricia Williams wasn't just investigating Dr. Hayes, she was using his case as an example to change the entire medical system. And tomorrow, the whole country would know about what happened at Pine Valley Medical Center. The next morning, Dr. Hayes woke up to find reporters camped outside his house. His story had gone national overnight. Every major news network was talking about the racist doctor who almost killed a patient. His phone hadn't stopped ringing since 6 a.m. But what Dr. Hayes didn't know was that Dr. Patricia Williams had spent the entire night preparing something that would shock the medical world. She had called a press conference for 10 a.m., and she was about to reveal information that would change how hospitals across America treat their patients. At 9:55 a.m., Dr. Williams stood behind a podium at the State Medical Board building. Dozens of reporters filled the room, and cameras from every major news network pointed at her. She looked calm and professional, but inside she was furious about what had happened to her brother. Ladies and gentlemen, she began. Yesterday, a doctor at Pine Valley Medical Center almost killed a patient because of racial discrimination. But this isn't just one doctor's problem. This is a problem that affects hospitals across our entire country. She clicked a remote control, and a large screen behind her showed statistics and charts. Over the past 2 years, our investigation team has secretly reviewed patient care at 15 hospitals in this state. What we found is shocking. The screen showed numbers that made the reporters gasp. Black patients were 40% more likely to be dismissed without proper treatment. They waited twice as long in emergency rooms. They received pain medication 60% less often than white patients with identical symptoms. Dr. Richard Hayes at Pine Valley Medical Center is not unusual, Dr. Williams continued. He's typical. Our investigation found that racial bias in medical care is widespread and systematic. It's not just a few bad doctors. It's a cultural problem that's literally killing people. She clicked to the next slide, which showed photos of patients who had died after receiving substandard care. These are just some of the people who died because doctors like Richard Hayes couldn't see past their skin color. Each of these patients went to a hospital for help and instead found discrimination. One reporter raised her hand. Dr. Williams, how do you know Dr. Hayes was motivated by racism? Couldn't it have been a simple mistake? Dr. Williams smiled grimly. Let me show you something that will answer your question. The screen changed to show Dr. Hayes's patient records from the past year. The information was anonymous, but the pattern was clear. White patients received an average of 28 minutes of examination time. Black patients received an average of 11 minutes. Hispanic patients received 13 minutes. This data comes directly from Dr. Hayes's own appointment records, Dr. Williams explained. When we control for all other factors, insurance, type of problem, severity of symptoms, the only variable that determines how long Dr. Hayes spends with a patient is their race. Another reporter asked, what about the specific case that triggered this investigation? Can you tell us more about what happened? Dr. Williams paused for a moment, and for the first time, her professional mask slipped slightly. The patient who was mistreated by Dr. Hayes is my brother, Marcus Johnson. He's a 45-year-old postal worker with no criminal record, good insurance, and a clean medical history. Dr. Hayes spent less than 3 minutes examining him, despite clear symptoms of heart problems. The room erupted in surprised murmurs. The reporters hadn't known that this was personal for Dr. Williams. My brother went to Pine Valley Medical Center trusting that he would receive proper medical care. Instead, he was dismissed, insulted, and nearly died because of Dr. Hayes' racism. But Marcus is lucky. He has a sister who works in the medical field and knew to get a second opinion. Most patients don't have that advantage. Dr. Williams clicked to another slide showing survival statistics. Black patients with heart attacks are 35% more likely to die than white patients with identical symptoms. This isn't because of genetic differences, it's because of differences in the quality of care they receive. She continued her presentation for another 20 minutes, revealing the results of the 2-year secret investigation. The statistics were devastating. Minority patients received worse care at every level, from initial diagnosis to treatment to follow-up care. Today, I'm announcing several immediate actions, Dr. Williams said as she concluded her presentation. First, Dr. Richard Hayes' medical license is suspended pending a full review. Second, Pine Valley Medical Center is being placed under federal oversight until they can prove they provide equal care to all patients. Third, we're expanding our investigation to hospitals in 5 other states. After the press conference, the story exploded across social media and news networks. Justice for Marcus began trending on Twitter. Patients from around the country started sharing their own stories of medical discrimination. Medical students organized protests demanding better training on racial bias. Meanwhile, Dr. Hayes sat in his lawyer's office watching the press conference on television. His lawyer, Mark Stevens, shook his head grimly. "Richard, this is much worse than we thought. She's not just going after you. She's using your case to launch a national campaign against medical racism. You've become the poster boy for everything wrong with healthcare in America." Dr. Hayes felt numb watching Dr. Williams destroy his reputation on national television. "Mark, what are my options? Can we fight this?" "Fight what? The statistics? The patient testimonies? The fact that you almost killed her brother? Richard, the evidence against you is overwhelming. Our only option is to try to minimize the damage." Dr. Hayes' phone buzzed with a text message from his wife, Linda. "I saw the press conference. I can't believe you treated someone's brother like that. The kids and I are staying at my mother's house indefinitely. Don't call us." That afternoon, Dr. Hayes received a call from Dr. Chen at the hospital. "Richard, the board of directors, held another emergency meeting. We're terminating your employment immediately. The negative publicity is costing us patients and staff. 3 of our best nurses have already quit because they don't want to be associated with discrimination." "Robert, you can't do this. I have a contract." "Read the contract, Richard. There's a morality clause that allows immediate termination for behavior that damages the hospital's reputation. What you did definitely qualifies." That evening, Dr. Hayes sat alone in his house watching the news coverage of his case. Every channel was talking about medical racism, and his name was mentioned in every story. Patient advocacy groups were calling him a symbol of everything wrong with American healthcare. But the most painful part was watching the interview with Marcus Johnson. Marcus appeared on the evening news with his sister, Dr. Williams. He spoke calmly and with dignity about what had happened. "I went to that doctor looking for help," Marcus said to the interviewer. "I was scared because I was having chest pains, and I trusted that he would take care of me. Instead, he treated me like I was worthless. He made me feel like my life didn't matter because of my skin color." The interviewer asked, "How do you feel about Dr. Hayes now?" Marcus thought for a moment before answering. "I feel sorry for him. He let his racism almost turn him into a murderer. He's lost his career, his reputation, and probably his family because he couldn't see me as a human being who deserved help." Dr. Hayes turned off the television and sat in the dark. For the first time since this all started, he began to understand the full weight of what he had done. He hadn't just provided bad medical care. He had dehumanized another person. He had let his prejudices override his duty as a doctor to help people, but it was too late for regrets. The damage was done, and tomorrow would bring even worse news. Because Dr. Williams wasn't finished with her campaign for justice, and Dr. Hayes was about to discover that losing his job was just the beginning of his consequences. 1 week later, Dr. Hayes sat in a courtroom facing the state medical board. The room was packed with reporters, medical professionals, and patient advocates. Everyone wanted to see what would happen to the doctor who had become the face of medical racism in America. Dr. Williams sat at the prosecutor's table with a team of lawyers and investigators. She had spent the week building an ironclad case against Dr. Hayes, but this hearing was about more than just one doctor. It was about sending a message to the entire medical community that discrimination would no longer be tolerated. The hearing began with testimony from Marcus Johnson. He walked to the witness stand with quiet dignity, wearing his Postal Service uniform. He had requested to wear it to show that he was a hard-working, tax-paying citizen who deserved proper medical care. "Mr. Johnson," the lead board member asked, "please tell us in your own words what happened during your appointment with Dr. Hayes." Marcus spoke clearly and calmly. "I went to Dr. Hayes because I was having chest pains that were getting worse. I was scared that something serious was wrong with my heart. But from the moment I walked into his office, he treated me like I was bothering him." Marcus described how Dr. Hayes had barely examined him, made racist comments, and dismissed his symptoms without running any tests. The board members listened with increasingly serious expressions. "How did Dr. Hayes' treatment make you feel?" another board member asked. "It made me feel like my life didn't matter," Marcus replied. "Like because I'm black, my pain wasn't real and my health wasn't important. I left that office feeling ashamed for even asking for help." Next, Nurse Sarah took the stand. She had resigned from Pine Valley Medical Center the day after Dr. Williams' press conference, unable to continue working in a system that allowed discrimination. "I saw Dr. Hayes treat patients differently based on their race for years," Sarah testified. "White patients got thorough examinations and kind treatment. Black and Hispanic patients were rushed through appointments and often dismissed without proper care. I should have spoken up sooner, but I was afraid for my job." Sarah's testimony was particularly powerful because she had worked closely with Dr. Hayes and had witnessed his discriminatory behavior firsthand. She provided specific examples of patients who had been mistreated, and her detailed records helped establish a clear pattern of discrimination. The most damaging testimony came from Dr. Jennifer Martinez, a cardiologist at City General Hospital who had treated Marcus after his appointment with Dr. Hayes. "Mr. Johnson came to our emergency room 6 hours after seeing Dr. Hayes," Dr. Martinez explained. "He was having an active heart attack. If we hadn't immediately started treatment, he would have died. The symptoms were so obvious that any first-year medical student should have caught them," she continued. Dr. Hayes' failure to diagnose Mr. Johnson's heart attack wasn't just medical malpractice, it was nearly medical murder. There's no excuse for missing such clear symptoms unless you simply don't care whether your patient lives or dies. When Dr. Hayes finally took the stand in his own defense, he looked nothing like the confident doctor he had been just 2 weeks earlier. His expensive suit couldn't hide the fact that he had lost weight from stress, and his hands shook as he was sworn in. Dr. Hayes' lawyer had advised him to show remorse and take responsibility for his actions. But Dr. Hayes' pride made it difficult for him to admit how wrong he had been. "I made some mistakes in my treatment of Mr. Johnson," Dr. Hayes said carefully. "I was having a busy day and didn't spend as much time with him as I should have. But I never intended to discriminate against anyone." Dr. Williams stood up for cross-examination. She had been waiting for this moment, the chance to confront the man who had almost killed her brother. "Dr. Hayes, you testified that you were having a busy day. Can you explain why your appointment records show that you spent 45 minutes with the patient before Mr. Johnson, but only 3 minutes with him?" Dr. Hayes shifted uncomfortably in his chair. "The previous patient had more complex symptoms. The previous patient came in for a routine checkup. She had no symptoms at all. Mr. Johnson came in with chest pain. Which patient had more complex symptoms?" Dr. Hayes realized he had been caught in a lie. I don't remember exactly." "Dr. Hayes, you told Mr. Johnson, these people always think everything is a heart attack. What did you mean by these people?" "I meant patients who come to the emergency room frequently. But Mr. Johnson had never been treated at your hospital before. His records show this was his first visit. So what did you really mean by these people?" Dr. Hayes sat in silence, knowing that anything he said would only make things worse. Dr. Williams continued her questioning for another hour, systematically destroying every excuse Dr. Hayes tried to make. She showed that his discriminatory behavior wasn't a mistake or an accident. It was a pattern that had been going on for years. After all the testimony was heard, the medical board deliberated for less than 2 hours. When they returned, the lead board member looked directly at Dr. Hayes. Dr. Richard Hayes, this board finds that you violated your oath as a physician and endangered a patient's life through discriminatory treatment based on race. We hereby revoke your medical license permanently. You are banned from practicing medicine in this state or any other state. Dr. Hayes felt the words hit him like a physical blow. His medical career was over. Everything he had worked for since college was gone, but the consequences didn't stop there. The following week, the FBI announced that Dr. Hayes would face federal civil rights charges for violating Marcus Johnson's constitutional right to equal treatment. If convicted, he could face up to 5 years in prison. The civil lawsuit filed by Marcus Johnson was settled out of court for $2.3 million, money that came from Dr. Hayes' malpractice insurance and personal assets. Dr. Hayes was forced to sell his house, his cars, and most of his possessions to pay legal fees and damages. Meanwhile, the case had sparked a national movement for healthcare reform. Dr. Williams was appointed to lead a federal task force on medical discrimination. New laws were passed requiring hospitals to track patient care by race and report disparities to the government. Medical schools across the country began teaching mandatory courses on racial bias in healthcare. Hospitals implemented new procedures to ensure equal treatment for all patients regardless of their race, and patient advocacy groups were given more power to investigate discrimination complaints. 6 months after the hearing, Marcus Johnson fully recovered from his heart attack. He returned to work at the post office and became a spokesperson for patient rights. He traveled around the country telling his story and encouraging other victims of medical discrimination to speak up. Dr. Hayes thought he could treat me badly because he didn't think I mattered, Marcus said in a speech to medical students. But what he didn't understand is that we all matter. Every patient deserves respect and proper care, no matter what they look like or where they come from. Dr. Hayes spent the next year fighting federal charges, but eventually pleaded guilty to violating Marcus Johnson's civil rights. He was sentenced to 2 years in prison and 3 years of probation. His lawyer recommended the plea bargain because the evidence against him was overwhelming. On the day Dr. Hayes was sentenced, he finally spoke publicly about what he had done. Standing before the judge, he looked broken and ashamed. "Your Honor, I destroyed my career and almost killed a man because of my own prejudices. I let racism poison my judgment as a doctor. I violated my oath to do no harm, and I betrayed the trust that patients place in physicians. I accept full responsibility for my actions, and I hope that my punishment will serve as a warning to other doctors that discrimination has no place in medicine." The judge sentenced Dr. Hayes not just as punishment, but as a message to the medical community. "Dr. Hayes, you took an oath to treat all patients equally, but you let your racism override your professional duty. Your actions endangered a man's life and damaged public trust in the medical profession. Society must know that such behavior will not be tolerated." After Dr. Hayes was led away to begin his prison sentence, Dr. Williams spoke to reporters outside the courthouse. "This case was never just about my brother or Dr. Hayes," she said. "It was about creating a healthcare system where everyone receives equal treatment. We've made progress, but there's still more work to do. Every patient deserves to be treated with dignity and respect, regardless of their race." Marcus Johnson also spoke to the media. "I don't feel happy that Dr. Hayes is going to prison," he said. "I feel sad that it took almost dying to expose a problem that affects millions of patients. But if my experience helps other people get better health care, then something good came out of something terrible." Today, Pine Valley Medical Center has become a model for equal health care treatment. They have strict policies against discrimination, regular training for all staff, and patient advocates who ensure everyone receives proper care. The hospital where Dr. Hayes once worked is now leading the fight against medical racism. Dr. Hayes served 18 months in prison and was released on probation. He now works as a medical consultant for patient advocacy groups, helping to identify and eliminate discrimination in healthcare. It's not the career he planned, but it's his way of trying to make up for the harm he caused. The story of Dr. Hayes and Marcus Johnson changed American healthcare forever. It showed that racism in medicine isn't just morally wrong, it's literally deadly. And it proved that no matter how powerful someone thinks they are, justice will eventually catch up with them. Most importantly, it demonstrated that every patient matters, and every patient deserves respect and proper care, because at the end of the day, we're all human beings who deserve to be treated with dignity when we're sick and scared and looking for help. If this story opened your eyes to the reality of medical discrimination, make sure to like this video and subscribe to our channel. We tell stories about real injustice and the brave people who fight back against it. Because the more we share these stories, the harder it becomes for people to ignore the problems that still exist in our world. Remember, change starts with awareness, and awareness starts with stories like this one.